Hello everybody. This particular video that I'm making right now is a remake of a video that I did about 3 weeks ago, and I had out of the whole video clip one erroneous line, but it was an important one, important enough that I thought it was good to retape the video. So here is the second redo on DEXA scans, useless DEXA scans. Bone is living tissue and constantly remodels. Bone mineral density peaks during the reproductive years of women and then begins to decline during menopause. In other words, loss of bone mineral density is a natural result of aging. Osteoporosis is a condition in which bones become weaker and more brittle and therefore more subject to fracture. This is distinctly different from normal age-related loss of bone mineral density. Women in westernized countries are told that osteoporosis is an epidemic. We call everything an epidemic here in this country, and therefore a screening is necessary in order to catch the disease early and treat it before the bones start to break. The most commonly used screening tool is dual energy X-ray absorptiometry, or DEXA. But the problem is the test results from DEXA are based on a comparison of the individual's result to healthy young women, not necessarily compared to you when you were a younger woman. Most people think that the test is reliable and based on scientific evidence, but it's not true because, in fact, the main reason why DEXA scans even became widely used was not based on scientific evidence. It was based on the marketing efforts of Merck, one of the companies that makes drugs to treat osteoporosis. Every time I tell these stories, you'd think that this stuff would not happen anymore, but it does. So here's the story of how DEXA became such a big deal. Fosamax, made by Merck, was the first drug in a category called bisphosphonate drugs, which were developed for the treatment of osteoporosis. The drug didn't sell well. The reason was at the time that it was introduced, women were not diagnosed with osteoporosis until they experienced a fracture, which was not a common occurrence. In order to transform Fosamax into a blockbuster drug, Merck needed to change the way that osteoporosis was diagnosed. So the company, with the cooperation of a panel convened by the World Health Organization, invented the idea that loss of bone mineral density was a sign of disease, not aging. The change was significant because we're all getting older, so it meant that sooner or later we could all be diagnosed with it. At the meeting where this was decided, an arbitrary level of bone density loss was chosen to define the disease. The panel also had a discussion and determined that patients who were borderline would be labeled as having a newly made-up condition called osteopenia, or pre-osteoporosis. We have pre-diseases for everything now. It's a way you can drug more people. The major problem with this is that bone mass does not produce the risk of fracture. For example, the incidence of fracture in Asian women is much lower than Caucasian women who have relatively higher bone mass. A study including 840 women aged 35 to 75 years of age from 5 rural counties in mainland China showed that almost all of them over the age of 50 had bone mass lower than the fracture threshold set for American Caucasian women, but almost none had signs of osteoporosis. Less than 4% of them had fractures during their lifetime. Researchers who looked at records for over 2,000 cases of fracture concluded, quote, "We do not recommend a program of screening menopausal women for osteoporosis by measuring bone density." Nonetheless, in the pursuit of profits, Merck set out to make testing bone density both easy and inexpensive. At the time, diagnostic equipment for osteoporosis was very expensive and most doctors' offices did not have this type of equipment. So Merck purchased a medical device company, subsidized the manufacturing cost, and developed leasing programs so that every doctor's office and health facility could afford to have one machine. And so that's why you see DEXA scans free at health fairs and all that sort of thing. They made it really, really cheap. The company also mounted expensive advertising campaigns to warn women of their risk and also to convince doctors that women need to be screened with a baseline screening at the age of 50. Merck's lobbyists pressured Congress to mandate that Medicare reimburse for the scans, which paved the way for payment from all third-party payers. The diagnosis of both osteoporosis and osteopenia, of course, increased as a result. Fosamax became a blockbuster. Lots of other drugs were developed and released and approved by the FDA to treat pre-osteoporosis and osteoporosis. The fact remains, however, that DEXA scans are inaccurate. In addition to measuring a marker that has little to do with bone strength, several factors can influence test results, which include the particular manufacturer of the machine, the tech operating the machine, the clothes the patient's wearing, movement during the scan. The variability ranges 5 to 6%, even if you get everything right. Now, it's a variation that is much bigger than it seems on the surface because changes in bone growth and remodeling are measured down to hundredths or thousandths of a decimal point, so the margin of error can represent up to 10 years of aging and bone loss. In one study, bone specimens that had been immersed in hydrochloric acid solution specifically to degrade bone mineral density were then tested using DEXA. The researchers reported that the bone density of the specimens changed much more than reported by the scans. To illustrate the unreliability of DEXA, a New Zealand television show sent a 50-year-old woman to be scanned by 2 different brands of DEXA machines. She was slightly below normal when tested by one machine. When tested by the other, was told the results were so far below normal that she had osteoporosis and needed to begin taking medication immediately. The bottom line is that the scans are useless and most diagnoses are false. Since people have been trained to think that screening for all conditions is the best path for preventing disease or death, a lot of people ask me, well, if I'm not going to have a DEXA scan, what should I do? Well, there aren't any effective screening tools for osteoporosis and for most things at this time. Plus, the screening programs for almost everything except cervical cancer have been a dismal failure in terms of preventing bad things from happening. So there are ways to improve and maintain bone health, and that's what we should be teaching people to focus on. Instead of eat, drink, and be merry, have a DEXA scan and take Fosamax, how about you work on bones and preserving your skeleton, which was designed to last as long as you do, by the way, by doing the right things. So what are the right things? Well, first thing is diet. A low-fat, plant-based diet is better for preserving bone density, while a diet high in animal foods promotes loss of bone density. All right, so the right diet helps a lot. Exercise stimulates bone remodeling and leads to higher bone density. The more muscular you are, the less likely you are to develop osteoporosis or have broken bones. Body strength. A study published in the British Medical Journal showed that the risk of fractures could be predicted with an accuracy of 96% in men and 93% in women using factors such as body sway and muscle strength. Gastrointestinal health. A healthy gastrointestinal tract allows for the absorption of bone-building nutrients, including calcium from food. And then sunshine. Promotes the production of vitamin D, which is actually a hormone, not a vitamin. I have to throw that in every time the words come out of my mouth. But supplements are not a substitute and are useless for improving bone health. You actually have to go out in the sun. And then some pharmaceutical drugs like corticosteroids are thin out the bones, so be very careful about pharmaceutical drugs and discontinue those that you can. If you have already lost an abnormal amount of bone density due to any of the factors that I mentioned here, remember that bone is living tissue. I think there's a big misunderstanding that some people have that by the time you're 18 or 21, your skeleton is the same and it stays that way until you die, and that's not true. It remodels constantly, so you can build bone density by paying attention to the things that I just told you. The drugs typically used to treat it are useless. You can see articles on this in the Health Briefs Library. They're useless and harmful, and they actually cause some of the problems that they're supposed to prevent, like fractures. Nothing like taking a drug to prevent fractures that causes fractures. Good reasons to pay attention to the diet and lifestyle factors. Okay, hit the subscribe button if you're not a subscriber. Pass this on to anybody else who you think might enjoy watching it. I'll be back to you next week with more news.